Shana Parker, and I'm doing my speech on oral cancer. Have you ever watched an old Western movie where the cowboys spit in there chewing tobacco, or a movie where children, or not children, but teenagers are at parties drinking and smoking? Well, when you're young it looks cool, but every time you take a sip of beer or spit your tobacco or inhale a cigarette, you're increasing your chance of getting oral cancer. Not only can you get oral cancer from tobacco, but you can get it from alcohol too. And a lot of the times, you don't even have to smoke or dip or drink. You can get oral cancer from secondhand smoke. Stuart A. Green from QualityDentistry.com said that it's more common for a non-smoker to get oral cancer than a smoker. To me, I think oral cancer isn't taken very seriously. And to be honest, I didn't take it seriously until someone I was very close to got diagnosed with it. The reason I chose this is because I've seen firsthand how it can affect someone's life. And I think that people should know how it will so that they can try to prevent it from happening to them and their families. A lot of people are unfamiliar with oral cancer, so today I'm going to tell you about how to look for signs, how to prevent it from happening to you, and how you can slow it down if it does, and how it could affect your life. First, I would like to teach you how to look for signs and symptoms. There are many different signs of oral cancer, but some can be mistaken as other things. The most common signs are a sore on the lip or in the mouth that doesn't heal, a white or red patch on the gums, tongue, or lining of the mouth, bad breath, sensory loss of the face, a lump in the mouth, a pain or numbness in the neck, oral pain that does not go away or feeling like something stuck in the back of your throat, difficulty or pain with chewing and swallowing, difficulty with jaw opening, swelling of the jaw that causes dentures to fit poorly or loosely, and tooth loosening. Oral cancer doesn't just happen in your mouth. Oral cancer includes cancer of the lips, tongues, cheek, floor of the mouth, hard palate, gums, and minor salivary glands. And now that I've told you about the signs of oral cancer, I will tell you how to prevent it from happening to you. One way to prevent it is to not use tobacco products at all. Another way you can prevent it or slow it down if it does happen is to be screened regularly for oral cancer. Treatment options depend on the following: the stage of cancer you're in, the size of the tumor and where it is located in your lip or oral cavity, whether the patient's appearance and ability to talk and eat can stay at the same time, and the patient's age and general health. Now that I've explained how to prevent it, I'm going to tell you how it can affect your life. Oral cancer, like all cancers, can end in death, but throughout the researching for this speech, I couldn't find much online about how it could affect your life. So I asked my teacher if I could tell you how it affected my uncle's life, and she said it would be fine. He was diagnosed with oral cancer the first time, went through radiation, thought it was gone, and it came back. After it came back, he chose not to do the radiation again, and eventually lost his motor skills, which means he couldn't remember things or people. He couldn't remember what he said 5 minutes ago, couldn't remember things he had done. He couldn't eat solid food. He had to be fed through a feeding tube. He couldn't drink anything. If he did, it had to be through a tube or a straw. And eventually the cancer started eating away at his face, and he didn't have anything but the bones left. To me, it was the most horrifying thing I'd ever seen, and that's why I try to tell people about it, because you don't really want to see someone you love like that. In conclusion, the reason I chose this is because I've seen firsthand how oral cancer can affect someone's life, and I think that people should know about it so that they can try and prevent it from happening to them and their families. Today I've talked to you about how to look for signs, how to try and prevent it and treat it, and how it could affect your life. As I stated earlier, I think oral cancer isn't taken very seriously. And remember, not only can tobacco users get oral cancer, but alcohol drinkers can too. And it can often be mistaken as a sore illness or another dental problem. Thank you.